Oh no, you have to be CPR trained to use AED. So it's a life-saving equipment. You can't just anyhow put AED on anybody who has lost consciousness because it's hard to be. So I think have a look how does a AED look like. I can show you different component of the AED.
Oh, okay, great. Let's go. So could you tell us more about how we go about using this AED?
So this is actually a real AED or automated external defibrillator. If you see a patient who is unresponsive, you should check the surroundings, make sure it is safe to go near him, and once you go near him, tap on his shoulder. Hello, hello, how are you? Are you okay? If there's no response, you should call for help, and you should call 995. You should ask for AED. That means if there is somebody nearby who can bring a AED, please get a AED. And if you know CPR, you should check patient's pulse. If there is no breathing, no pulse, you can start CPR. And if fortunately,
hang on, pulse check here.
Pulse check on the neck. So you can just put your 3 fingers here next to your trachea. Just feel your trachea here, just roll your finger next to it. You can press a bit, you can feel your carotid pulse.
So it's not here?
Not here. It's very difficult, this one not easy, but carotid pulse is the very reliable pulse. If there is no pulse, no breathing, you should open up his airway, and if you know CPR, can start CPR. And if somebody brings this AED, then this AED should be attached to the patient, and I'm just going to show you how it works. Once you open up, there are patches which have to be put on patient. And this button, once you press it, it will start this prompt.
Unit, okay, adult dead.
So,
stay calm, check responsiveness, call for help.
And this call for help is call for
open airway.
Open airway.
Check breathing.
Check breathing.
Attach defib pads to patient's bare chest.
So this is the defibrillation pad. If you look at it, you can see it is giving you clear instruction how to open up this pad and how to put these patches on the patient. So once you attach this patch to the patient, then it will go to the next step of CPR, and it will analyze patient's rhythm. It will deliver a shock if patient is having a rhythm which can be shocked. And after that, it will tell you how to resume your CPR. This will
attach defib pads to patient's bare chest.
This will also guide you through the steps of CPR. That means after the first shock is over, it will analyze the rhythm again and advise you to continue CPR. You can carry on until there is a help or until patient is conscious again.
I don't know whether grandma is having like some giddy spell. She's pretty worried about fainting. So how often and when should she be worried about fainting? Sorry, I rephrased my question. Okay, I
can eat some.
I eat something.
Get some glucose.
Sorry, I have enough sugar now. I can ask question.
Okay.
When should I be worried about fainting?
That's a good question as well. Fainting is loss of consciousness. We should be worried if we have sudden loss of consciousness which is not provoked. Provoked means sometimes if you suddenly stand up, you might feel a bit of giddiness that is considered normal. But if you are just watching TV or relaxing and suddenly lose consciousness, that is abnormal. That means it could be related to your heart rhythm, heartbeat, heart attack. You don't get to spin it.
No.
Okay.
I only punish the...
Okay. Good.
Okay.
What was the weirdest request you have gotten from a patient? Usually patients are very reasonable, they don't ask for unreasonable things actually. But I think the most weirdest request I feel is when they ask to take pictures with you. So there's this lady who said, I want to take picture with you. I said, okay, we'll do your pacemaker and then we will take. Next day when I went to the ward, she's like 70 plus, She was wearing all red lipstick and all those things, All her eyelashes were all, the made up eyelashes one. She was ready with her camera actually to take picture.
Maybe that's my grandma. You never know. We are now coming to our final question.
Okay.
No, actually final got A and B.
Okay, no worries.
Okay. So other than pacemaker, what are other treatments for irregular heartbeat? And you mentioned ablation. So what else?
Catheter ablation can be done by 2 forms. One is radiofrequency energy. Another is called cryoablation. Cryoablation is a method where we cool down the heart tissues with liquid nitrogen to a temperature of minus 70 to minus 90 degrees Celsius, and can achieve the same effect as scarring the muscle with heat. So this is another form of catheter ablation.
Spin the wheel.
Let's see. There.
You're so lucky. Ever
I
since
think
the chips.
is again truth. What's one misconception about cardiology you would like to address? Actually, this is a good question. And
Good.
one misconception about cardiology or heart problem is sometimes patient feels that anything to do with his chest is all related to his heart. I think the concern comes from fear of getting a heart attack. Not all symptoms occurring in chest are related to heart.
How would we know?
But yeah, you're right.
How would we
I think you still have to see a doctor for that. And sometimes after doing tests, we can exclude heart as a cause of your symptoms.
No, I just asked. I heard this before. They said that if you can hear the heartbeat in your ear, it means that you have some heart palpitation problem. Is that true?
No, you can normally hear your heartbeat in your ear. It's just depending on your sensitivity. If you can just lie down to your left side, which your heart is, you can even feel your heartbeat pumping in your chest or in your ear. So that is normal. Don't try to feel it, because once you get used to it, it will trouble you. Because then you can start feeling it when you are relaxed.
Causes of palpitation can be coming from food items as simple as a daily dose of coffee or flight of anxiety. However, some palpitation should not be dismissed because it might lead to a bigger problem. Based on Singapore statistics, almost 3,000 people have sudden cardiac arrest every year in Singapore. Cardiac arrest kill more people yearly than cancer, stroke, or trauma. Yet, the initial treatment is fairly simple and effective if delivered early, such as CPR and defibrillation. Be sure you really use your heart to feel and make decision to screen your heart early, especially for men above 40 and women after menopause. So I better remind grandma about it.
Terima kasih telah menyaksikan video ini, dan jangan lewatkan video menarik lainnya dari channel Tekon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tekon TV.